Hello there, my name is Anne Longfield. I'm the Executive Chair of the new Centre for Young Lives. Formerly I was Children's Commissioner for England, but I've spent most of my adult life working on the issues that we're going to be discussing today. So very pleased that we've got this focus here today. Welcome to this webinar. We're so pleased that you've been able to join us and to spend your precious time looking at these issues. The webinar is building on our most recent report, which comes as part of a series of reports with the Child of the North and with the Northern 8 universities. This is a series of reports which is gathering together evidence but also practical solutions, which will form the basis of a campaign to really put children, young people and their families at the heart of policy making. We want to see the next government putting children as a high priority and putting the engine of government behind all they do to achieve change for children. The programme of seminars and also reports is ambitious, 12 reports over a year, and we'll be bringing those together at the end into a compendium. We want to show not only what the case for change is, but also that it is doable and that many are already on that journey. So we look forward to the discussion today in terms of how we make some of that happen. Now, this webinar is all about the most recent report, which is looking at how we rebuild an infrastructure of support for children and families and put a focus that it's in and around schools, what we've called setting the new foundations of a fresh start for Sure Start. And when we look at that, whatever topic we've looked at in terms of children's lives and need and families too, it comes back to the same thing. We need early intervention to be able to spot those problems, identify need and respond as early as possible, both to tackle the problems there and then, but also to prevent them escalating into crisis. We know there's been a huge reduction in funding for early investment and early intervention over the last 10 years. And the estimates of that range between 45 to even 70% for periods in terms of the drop-off in funding. And that means there's been so much less funding for children's centres, for Sure Start, and indeed for youth provision too. And what I think we can see is that the impact of that, the cost of that, is now being seen in so many children's lives. We know that there's been soaring mental health problems in children, again, rocket fueled by the pandemic. We know that there's huge absenteeism rates in school and real crisis in attendance. We know the numbers of children who are actually going into care or in need of social care is also increasing. On every turn we look out in children's lives and we look at what the evidence tells us, it tells us that things are going in the wrong direction. Families are struggling to support and for support. Number of children in poverty is rising, and the impact of that on all aspects of their lives is clear to see. And we also know that professionals, but also schools and school staff are seeing that so clear. The children coming through the door have increasing numbers of problems that schools are struggling to respond to. And we know that a lot of schools feel that when they turn around for help with other services, those services that are struggling themselves just can't respond. So what we're putting forward is the steps, the foundations for how we could build and rebuild that infrastructure of support for children and for families. It would take all that was good and worked around Sure Start and children's centres, that place-based approach, that importance of relational support, the ability to be able to have trusted people that you could turn to, and that relentless focus on early intervention. A universal door, but with targeted support within there. We think that from the evidence that we've gathered and from what you all know in terms of the good practice already happening on the ground, there are fantastic examples of schools, communities, services working together, sometimes through formal hubs, sometimes in a much more organic way, but importantly, working with children, working with families. And that's what we're looking at here in terms of how we can grow that support. What will it take? Well, we think it will take government ambition. We think it will take a national lead, because it's very clear that schools can't do this by themselves. But also, we can't rely on schools getting to the point where they have either the capacity or the will to do this. So we'd like to see a national programme. We think it needs ring-fenced funding, and we think it needs to embrace and build upon the fantastic activities and support that already is in place. Importantly, though, to have a mechanism for join up of public services. So we're being ambitious with this, and we know that that's what not only services want to see, but also, importantly, children and parents themselves. We've been delighted to work with our partners on this report and this series, but most of all, what we're doing is campaigning for change. So we'll be asking you to sign up to that journey too, to get behind that campaign. I know that there's a fantastic array of speakers here who are doing brilliant things, but I think they too will agree that we want to see this everywhere. We want this to be what our offer is to children in this country. And the benefits of that will be enormous, not just to those individual children and their families, but for us as a society. And of course, there's always that question, can we afford this? Well, the cost of crisis is huge. We cannot afford not to do this. And every investment in the early years and in early investment and early intervention, we know will bring huge savings in the long term. We've seen that in the evidence. So I hope you enjoy this webinar, and I hope that we hear from you about your own practice and the real gains that I know you will be making. But also to say thank you for joining us, and thank you for your commitment, and do come with us on this journey and on this campaign. Thank you.
Hello, I'm really delighted to be here today to talk to you about reimagining Sure Start and schools as interagency hubs as one of the key authors of this report, working with a massive team, a really fantastic team. It's been a real privilege to do this. I'm going to tell you about what are the key things we need to think about this work, about reimagining Sure Start and schools as interagency hubs. Why would we do it, but what do we need to think about? And what can we learn about the past, but also what can we learn about examples in the current time? First, I'm going to repeat the different recommendations. Really important to just think about the words of them and think about what we put in them, because they're really important and key. We're first of all calling to commit to a national strategy that puts schools at the heart of connected and co-delivered services for children and families. Number 2, create a strategic and governance framework with adequate ring-fenced funding so UK schools can lever and access programmes, activities and services that meet the needs of their communities. And 3, encourage holistic and collaborative working by co-producing connected services with children, young people, families, and the wider community. So why do we need to do all of that? Well, we know that all children and families need a range of things to thrive, from goods, services, agencies, activities, relationships, communities. And we can see this at different levels of an ecosystem and the different kind of levels at which organisations need to work together. We were near to delivering this in the 2000s through the extended schools in conjunction with Sure Start, with some very imaginative approaches to delivering children's services, with a whole core set of activities, which was then cancelled in 2010 with a new government. We've carried out in Newcastle University, with Manchester University, a whole range of different evaluations and research into these different programmes of extended schools. And we've also, in the last 10 to 13 years, had austerity that's led to rise in child poverty. massive rise in child poverty, and it's not been met by a national strategy to address child poverty. And part of the austerity has meant cutbacks in child services across the board in local authorities, with a 49% reduction in spending on early intervention, and we've seen a 47% rise in spending on late intervention services, which is related to not having early intervention. If you don't have early intervention, you're going to have to respond later to those problems. So children are not getting timely help, children are ending up more in care, they're not getting help for special needs, they're not getting help for mental health. That timely help is not available. Children are falling through the cracks of our services. And there's a real need to do things. So children are falling through the cracks. And whilst we know we are not going to get a massive influx of cash into our services do need some. But one way to prevent falling between the cracks is to make the distance between children and those services much less. One way to do that is to place the services nearer to children in schools, in educational settings. Another way is for different settings, different organisations to work together to leverage more resources and to leverage innovations in services. And we're seeing examples of all of these in the case studies at the end of the report, and I'll be saying something about this later. But I want to actually spend quite a bit of time on the last 3 slides. This one, I'm looking at what are the main things we can learn and about what we need to do in connecting services, innovating services around school and activities around schools, in reimagining Sure Start and extended schools and schools as interagency hubs. What's that reimagining about? So I'm just going to very quickly mention a few key things. It's got to be place-based, of course. Everything we do is going to be varied according to the children, the young people, the setting, the history, the different agencies that are there, the kinds of schools that are there. You know, what are the resources there, including the people resources. It's going to be varied, and we're seeing incredible variety at the moment. There are, what we're saying is education settings at the centre. Of course, it could be other settings at the centre. There are other anchor institutions around, such as housing associations, as an example. But we're making the case for education settings because most children attend school, not all, of course. They're trusted, they tend to be trusted organisations. They tend to be organisations that have links with other organisations. And they've also got a history of doing this, and we have many examples. We're saying a partnership approach, which I've already mentioned before, but we've got to act in partnership so that we're thinking about the interests of the other organisations. How can those interests be met by this kind of way of working? What are the interests, and where do our interests meet? An assets positive way of looking at things, not a negative deficit. So let's look at our communities in a positive way. Yes, people have needs, communities have needs, they're varied, some of them are really, really very extreme, but whatever are the needs, people have assets, people have personalities, they have histories, they have resources and skills, and communities can offer something. We're saying early intervention and not late. We've mentioned that before. If you don't focus on early intervention, you're going to have to meet those needs later, somewhere or another, whether it's when people are adults in mental health problems or offending or all kinds of different things. But let's meet those needs. Let's have early help, timely help, but also early needs and early years help. Long term, let's not have short-term initiatives that only finish after a couple of years, which we've seen with the really good opportunity areas and family hubs, but far too short-term funding. Co-produced as part of being partnership, but part of that co-production is something that is new in my experience in comparison to extended schools. We didn't see children, young people, caregivers and communities taking lead in decision making. We are seeing that now, and there's some fantastic examples of that at the end of this report. We also didn't see much planned sharing of data and information across different services in extended schools. There was wanting to do that, but we didn't see many examples. And that, again, that sharing of data and the information, obviously with safeguards, is really important. What we did see in the early 2000s was evidence-based research with planned evaluations and evidence-based interventions. We saw quite a lot of that. But, and we're seeing some of that now, but not an awful lot of investing in research to find out what is working, what is happening, what's working well, why is it not working well. Of course, different projects vary, and I know London Action Zone is doing an incredible amount of research, and so are some of the other projects. So, what are the drivers of effective, of actually getting this reimagining going? What's going to make it happen? We're in a different situation now to where we were before. It's very different to the 2000s where we are now. I've mentioned some of the reasons why, but we have to start with where we are. So yeah, we do need some funding and some resources, but we need realistic expectations, and our collaboration needs to release those resources as well. But what we had in Every Child Matters was a real focus on joined up at a government level and at other levels, and we need more of that now, connected government departments. But we've got an opportunity in the regional delegation, the regional devolution of the different mayoral areas across the country now, an increase of devolution, and that's a really good opportunity now for having integration at different levels. And even if there isn't responsibility for a certain area, and actually that's with different departments, we can have integrated care boards required to involve education leaders, for example. And there's lots of quality assurances in the different areas that we're talking about, but we know from other things that are happening that some of these quality assurances are not fit for purpose. So, for example, Ofsted criteria needs to be amended to value a broader set of community aims, including interagency collaboration. And we've noticed that, for example, childcare homes, really high profits, including some nursery chains, and we need to regulate for the quality of the care and the education, but also we need to regulate and have some kind of social licensing that looks at funding.
Hi everyone, my name is Dr. Simon Peeney. I'm Associate Professor of Child Health Research at the Leeds Institute of Health Sciences, University of Leeds. My particular research interest is young people with long-term physical health conditions and the needs they have at school. When researching in this area, I've become more and more aware of how young people and families have needs that schools are trying to address, but that cover a range of different kind of areas of their lives, and an interconnected sort of multi-service approach through schools would be the best way to address the needs of the young people that I work with, and certainly across the board for young people and families. So I'm going to present an overview of some of the evidence that's in the recent report, an evidence-based plan to build the foundations of a new Sure Start in and around education settings, and I would urge you to read the report for more details. So the evidence in this area is overwhelming and unequivocal. Children's services in all areas are underfunded, overworked, and under great pressure to meet the needs of young people and families. The UK is also performing poorly across most measures of childhood well-being compared to the other 30 wealthiest countries in the world, and is falling further behind year by year. So you can see this snapshot from the recent 2024 UNICEF report card on the well-being of children. You can see that the UK is now outside of the top 15 in the average overall well-being for children and young people, and outside of the top 10 in material well-being, health and safety, education, behaviours and risks, and housing and the environment, and is heading further down this list as time goes on. So children's services, health, education, policing, social care are now at the front line of the battle against growing levels of child poverty, compounded by the COVID-19 pandemic and the cost of living crisis. And we have to address this now to help our children and families overcome the challenges they face. We must make our services and support more effective, better connected, and with the needs of children and family at the centre of all of our decision making. So why must children's services better connect? Well, the value of multi-agency working has been established for decades. Every Child Matters, launched in 2003, created a framework for Sure Start centres and extended schools. And this was followed up by the introduction of education healthcare plans in 2014 and family hubs and the Start for Life programme in 2023. However, the funding for services of this kind over time and the capacity allocated has been decreasing over time as the needs and inequalities that young people and families in the UK face have been increasing over time. So as an example, school nurse provision has fallen to 852, yet it's estimated that 25,000 nurses would be needed to provide one school nurse in each secondary and primary cluster throughout the country. In January 2021, there were 430,000 young people with education healthcare plans maintained by local authorities, which was an increase of 10% during that year. But it's also estimated that the number of young people requiring education healthcare plans vastly outnumbers the amount that actually have them at this stage. As another example, referrals to urgent and emergency medical health crisis care rose by 80% between April and June 2021 compared to the same period in 2019. It's also estimated that by the time disadvantaged young people sit their GCSEs at age 16, they are on average 18 months behind their wealthier peers. Around 40% of that gap has already emerged by the age of 5 years. So there's an increase in the need for services, and there's also an increase in inequalities that we see across these services. And unfortunately, the cavalry is not coming. An idea that we would have a vast influx of extra funding and capacity and resources to address this across the board is unrealistic. So what we need to do is think about better interagency working and reprioritising of the capacity that services have in terms of to address the overall holistic needs that young people have. So why put educational settings at the heart of connected and co-delivered services for children and young people? Well, they're central community organisations with regular contact and relationships with children, young people and families. They also have upstream contact compared to more acute services like the police and hospitals. School closures during COVID-19 highlighted the need for regular visibility of children and young people, and these young people had reduced access to essential services such as school nurses, SEND support, and exacerbated concerns about mental health, sleep, diet, speech, language skills for those young people that were no longer in regular contact with schools and regularly sort of visible to services. And as with most situations that we come across in research and frontline services, low-income families and those from most disadvantaged areas were the most impacted during this time. A cost-benefit analysis found that spending on extended schools is likely to bring much greater savings on future adult services. So this kind of upstream addressing of issues is very likely to have downstream benefits and cost savings for wider services. So a strategic approach is needed to maximise the potential of schools to act as this kind of upstream hub for holistic services, to pick up issues as and when they're arising, address them more upstream and prevent kind of overwhelming of downstream services. So supporting children with long-term conditions with and through schools, which is an area that I'm particularly interested in. There's an estimated 1 to 1.7 million children and young people with long-term medical conditions in the UK, and that translates to approximately 4 children in every classroom in the UK. And it's likely that this number is underestimated when you take into account the vast diversity of long-term health conditions. Schools have a legal duty to accommodate children and young people with medical conditions, but there is currently limited resources and capacity for schools to really do this in amongst addressing academic needs, attendance issues, delivering data. It's very hard for schools to have the resources to adequately address holistic needs in school. It's also very inconsistently assessed by Ofsted. A recent Healthcare in Schools Alliance survey showed that only 17% of schools were asked about medical condition policies during their Ofsted inspection. Individual healthcare plans are inconsistently developed and sporadically applied. So a lot of young people who would benefit from an individual healthcare plan don't have one. There's limited consultation with young people when developing healthcare plans, and they aren't consistently applied across all of the young people who would need them. So we need to do some more work in sort of organising how that system works. There are examples of good practice: asthma-friendly schools, the Well at School website, DigiBeat for diabetes, and the Healthier Together programme. However, it's attendance is often one of the key issues that schools attempt to address, but there's been recent evidence that shows that school absence is not a mediating factor in the attainment of young people with long-term health conditions. And in fact, addressing the holistic needs for this group and providing capacity and support for schools to do this is likely to be the most successful way of improving attendance and improving attainment and general school well-being for this group. So why act early? Early intervention and education. So investing in early support for children is not just a moral imperative, but makes wise economic, health and social sense. Programs focusing on early childhood development enhance social skills, peer relationships, self-regulation abilities, academic achievement, physical and mental health outcomes. Investment in early intervention services such as Sure Start's children's centres has fallen by approximately 46%, while total expenditure on late interventions like youth justice, safeguarding, child protection, looked after children has risen by an equivalent amount. So there's some more evidence really that lack of investment in upstream services results in more investment in downstream services. Sure Start programme showed clear and evidence benefits for the holistic needs of children and young people, but also for communities, services and the economy. So investing upstream has clear evidence benefits for this group as well as the economy. So why share information for connected service delivery? The inability for public service organisations to share information acts as a substantial barrier to planning and delivering integrated care. Services are organised in silos centrally and locally, but children and families live and have needs across services, and anyone who works with children and families knows that they have holistic needs that don't fit nicely into the silos that we tend to work in professionally. The integrated care system faces many barriers to accessing and sharing data across systems. The Born in Bradford project and Connected Bradford is one example of demonstrating the value of integrated data sets for services and research. And this enables identification of patterns of unmet need across services and where we can target meaningful interventions in the future. If we can't share this data across services, it's very difficult for us to connect up what's happening for children and young people and target where to best intervene to make the most difference. It also reduces the likelihood of overlooking children and families with unmet needs who are perhaps flagging to multiple services who aren't aware of those children and young people's needs across different services. So what are the best models for connecting services in and around education? Luckily, the government and other agencies do not need to reinvent the wheel here. There's policies such as the Sure Start children's centres, Every Child Matters, extended schools, family hubs, and other international models which we provide evidence for in the report that provide principles for what works and route map and evidence for how to put these things into place. So we're looking for an amplification of effectiveness with better connections and addressing current capacity so that services can make the best use of the capacity they have and aren't spending unnecessary amount of time on things that don't directly benefit children, young people and families. There's also a disconnect between evidence and policy, and part of the reason for producing these reports is to try and present the evidence that can inform the development of new and improved policies in child health and wellbeing. And we urge the next government to heed the evidence and take advantage of the phenomenal education setting assets within the UK. Thank you very much.
Hello colleagues, my name is Sean Harris and I'm Research and Development Lead at Tees Valley Education, a multi-academy trust in Teesside. In this short case study, we'll consider some of the work we do as a multi-academy trust, how this is framed through people, policy and place, and why partnerships are essential to our work as community hubs. Let's begin by thinking about Tees Valley Education. Like all schools, we have a commitment to serving others, but this isn't just our children, it extends to our entire communities. Our communities are based in Redcar and Cleveland and Middlesbrough, and we know that they face significant challenges. We don't want to suggest that Teesside has it more complex than other educational landscapes, but we do know that the cost of living, economic turbulence, and economic instability have been significant and far-reaching for many of our communities. But myths exist about this too. Whilst poverty is hard-reaching and far-reaching, we don't believe that our communities are not aspirant, and we believe research supports our hypothesis on this. We realise our commitment to families through people, policy and place, and our work as community hubs is framed through these 3 Ps. Let me explain a bit more. When we think about our people, we have a professional development pathway that has poverty right at the core. This is based on specific barriers to learning that we know are faced in our communities. Many of our leaders are actively encouraged to look at specific community interests or additional areas of expertise they want to focus on. Examples include PhD-related study on poverty in Middlesbrough and coaching that some of our leaders have undertaken with local industry leaders. We accredit some of our pathways in partnership with others too, national partners such as the Chartered College of Teaching, with a hyper-local interest in the Teesside area. We recently had Dame Alison Peacock attend an event that we organised as a trust, speaking with education leaders, not only from the Chartered College of Teaching, but from the North East as a whole, and particularly Teesside, to understand the sector as a whole, but also the local pain points for teachers and educators. When we think about policy, our firm belief as a trust is that our work as community hubs cannot just be about tackling the symptoms of poverty or handing out welfare. These are of course vital, but to truly influence change at scale, we recognise our commitment to active campaigning and to research communities, working with organisations such as Bite Back 2030 to campaign for the extension of free school meal provision, contributing of course to our partners in this very seminar and learning from academics and researchers regionally, and reflecting that work through the work of the Child of the North and the research collaboration represented here. Committing to small-scale hyperlocal projects with children and families at the core. Many of our children recently participated in a creative arts project exploring concepts such as graphic medicine and health inequality in Teesside. We are active members of the Fair Education Alliance to influence sector-wide policy. Local industry partners such as PD Ports, AV Dawson, Casper Shipping and more work with us on creating a curriculum for children that gives them a sense of hyperlocal place and the local industry that exists in their community. Pupils and families have encouraged us to feature this more in our Tees Valley Education magazine to raise awareness about the types of jobs and offers for local families. When we think about place, we have a firm belief that deep social justice requires deep social listening. Hyperlocal opportunities exist in all our academies. Drop-ins, coffee mornings to listen and to learn with families. We facilitate meetings with leaders locally to consider and understand not only best practice but local pain points. Teachers and pupils are currently working with the charity Shine to look at how curriculum can better reflect local concepts and address misconceptions that children might have because of low income or poverty. We run a range of hyperlocal charity projects aimed at supporting social justice and encouraging all children to get involved in it, but without putting a financial burden on families. Our magazine is written with children and families in mind and with children as young journalists. Focus groups 18 months ago told us that while we have a deep commitment to social justice, it wasn't always visible in the magazine. Families and children have helped inspire us to feature articles regularly on low-cost free day out activities and where to eat on a budget, how to save pennies and pounds over difficult seasons such as Christmas. is an example of a recent project with a local independent bookshop in which many donated, instead of Easter eggs over the Easter period or toys, books for our children to read. Over 200 books donated and bought and sourced through a local bookshop for our children to benefit from in academic holidays. But being community hubs cannot just simply be about the work we do in individual schools at the front door. It has to be about a partnership with others. Expertise doesn't grow in silos. Community engagement has to be more than a welfare response to local people. Collaboration is key. Not only does it attract funding, but it allows for ideas to be generated and best practice to be shared. With that in mind, you might like to sign up to some of our free research roundup activities. We also feature regular links through webinars such as this to share best practice going on not only in our trust, but many schools that we work with nationally. Feel free to sign up for free to receive these, to find out how you could partner with us and work with us more. Thank you for listening.
Hello, my name is Nicola Noble. I'm co-head teacher at Surrey Square Primary School. The Big Education Trust is working to rethink school, to ensure that every young person receives a big education focused on the development of head, heart and hand. As a trust, we are working both in the system through our schools and on the system through our work which centres around developing talent, sharing practice and building a movement for change. Our approach to a big education at Surrey Square is encapsulated in this visual. We are working from the core, supporting our community to thrive and to build a better world for themselves and others. This is crucial as Surrey Square serves a diverse and socio-economically disadvantaged community. Families are dealing with many challenges, including financial insecurity, housing uncertainty, and immigration issues. So this is why we have created a school which is more than a school that is focused on meeting the needs of the pupils, their families, and the community. The impact of this approach is seen by the journey represented here. A small percentage of children start school on track, and this significantly increases by the time they leave us in Year 6. Our approach is expansive and holistic, led by our values of respect, responsibility, community, compassion, perseverance and enjoyment, which are central to everything that we do. At the heart of this is prioritising well-being, because we know that we could have the best curriculum offer, but if a child isn't okay, then they'll never be able to fully access this curriculum and achieve their full potential. Our whole school universal wellbeing offer underpins this approach. With expert input from Place to Be and CAMS, we've developed a journaling practice where every child journals at the beginning and the end of the week. These journals are reviewed by staff so that issues are quickly identified and dealt with. In addition, explicit wellbeing strategies are taught and space is given for these to be practiced daily. Children have dedicated curriculum time purely to connection and enjoyment each week. Where children need more than the universal offer, we draw upon specialist support. By working with Impact Ed, we are able to see the impact of this work and track children's wellbeing alongside their academic data. This is yet another tool to help us identify those who may need additional support and helps us to be able to track the impact of interventions. Family wellbeing is also important to us as children reside within family units. A highly skilled pastoral team meets weekly to reflect and think about the specific support families may need. Our family coordinator, Fee, offers invaluable support to our parents and has also built strong relationships with the local organisations, to which she is able to signpost parents for more specialist input where needed. Our interdisciplinary approach to the teaching of many national curriculum subjects focuses on learning being for a real purpose, and our curriculum goes beyond the national curriculum. We have identified the need for an identity curriculum and developed this to focus helping children to develop their sense of self. We have even added a community organising project, ensuring that children develop the skills that they need to help them build a better world for themselves and others, now and in the future. One of our value characters, Cole Community, talks about being small but mighty, and this is definitely lived by our incredible pupils. Through these projects, pupils have achieved many significant wins. Pictured here are pupils campaigning with partner organisations for fee waivers for those seeking citizenship. As a result, waivers were introduced in June 2022. And Year 3 children here are addressing the issue of pest infestations in many of their homes by calling and leading a meeting with the head of housing for Southwark Council. So how is more than a school achieved? Our staff team is extraordinary, and we understand that staff well-being needs to be a priority. In his book, I'm OK, You're OK, Thomas Harris highlights the importance of this, saying, if we are to be in a state to help others and respond in ways that enable, support and empower, then we have to be OK in ourselves. Our policies and practices underpin this, and staff surveys show that in contrast to the national picture, staff well-being data is positive. As a school, we understand that well-being doesn't just stop with staff, pupils and families. Community well-being is also critical as families live within communities. For many years, it was clear that despite high levels of investment in our local area, very little was improving. Our community has been underestimated and done to for too long. We saw that a different approach was needed. Set up in 2021, the Old Kent Road Family Zone, facilitated by Surrey Square, tackles these deep, complex social issues differently. Unlike traditional top-down community initiatives, this approach is doing with, focused on celebrating and strengthening, celebrating all the amazing things about our community, and believing the answers to issues are within the community itself. We are creating the right conditions for local people to engage and collaborate, and have the mindset to seek to unlock and build capacity locally. The community board, comprised of local residents and organisations, drive this work. The board goes through a powerful process of deep listening before working to understand the root causes of issues, then co-creating solutions and experiencing them together. They have designed a growing number of preventative services and projects to tackle challenging issues. The projects listed here not only offer solutions, but also the additional benefit of volunteering, training and employment opportunities for local people. Partnership with local and national organisations is crucial. We cannot do this work alone. Improving community well-being can feel like an overwhelming task. However, this approach, focused on creating the conditions for people to thrive, and then seeing lives improve one person at a time, proves that it is possible. Thank you.
Good afternoon, everyone. My name is Jim Lauder. I'm Trust Assistant Principal at Dixon's Academies Trust, and I'm just going to talk a bit about working with Citizens UK in educational settings in the context of the report that's been released, looking at an evidence-based plan to build the foundations of a new Sure Start in and around education settings. And I think working with Citizens UK or following a similar sort of methodology is a really important piece of this puzzle, because if schools are becoming places where a wider set of services is offered, or where other agencies are delivering those services through schools, it's really important that those services are based on what people actually want and what people in the school's community perceive as being important. And for that, I think listening is absolutely key. It's really important that when we're building this new Sure Start, we are doing with and not doing to. That we're not rocking up to schools and foisting a whole range of different services on schools without taking time to listen to, is that what that particular community needs? And so what we've tried to do at Dixon's is create the structures for schools to be institutions that can help local people build power for themselves. Now, I think it's really important to say from the outset that we shouldn't look to schools to host everything and solve everything, and for schools to do all this work ourselves. That shouldn't be what this is about. The primary purpose of school is to educate young people. However, I think it's definitely fair to say that schools are one of the few civic organisations left for families, where families have to interact with that organisation every day. And so I think it makes sense for schools to evolve to be places where people can get support, but also express themselves and say, actually, look, we don't need this, we need that instead. Now, ideally, this whole process would not happen with putting the onus and the emphasis on school staff, who really should, be sticking to the core business of education. Having said that, I just want to talk a little bit about how this process can work around schools, perhaps rather than within schools, and some of the successes that Citizens UK has had across the country with this sort of work. Now, with my Citizens UK hat on, I'm co-chair of West Yorkshire Citizens, and I've been involved in Citizens UK's growth in Bradford, but also across the north in Leeds, Liverpool and Manchester too. And it's an essential building block in terms of making sure that the broader offer around schools is right. So I'm just going to talk a little bit about first. It's a national charity for community organising. And what that means is it builds civil society alliances in different areas around the country. So, for example, there is a Bradford Citizens, there is a Leeds Citizens, a Liverpool Citizens, just in the process of growing at the moment, a London Citizens, a Cardiff Citizens, Nottingham Citizens, and so on. Historically, it's been focused on cities, but there's a Somerset Citizens now, and there's no reason why the methodology can't be applied to rural areas. And these alliances are alliances of civil society institutions. So not just schools, but also religious organisations like churches or mosques or synagogues or temples, but also perhaps community centres, trade unions, any other civil society organisation that is willing to be a part of a collective effort at making some change. And Citizens UK follows a methodology. They've been working for about 30 years in this country now, perhaps a bit over 30 years in fact, following a methodology of listening to people, bringing together what the outcomes of existing campaigns are, doing research, and then taking action in order to win changes from those in power. And the key point here is that the people doing this work are just ordinary people, leaders from the institutions that make up the alliances. They're supported by professional community organisers, but it's the leaders, it's the individuals doing that work. And the iron rule that Citizens UK has is don't do for others what they can do for themselves. So the emphasis is on building leadership, building capacity, and letting people stand up for themselves and letting people have a say in the democratic process and the political process. Citizens UK is absolutely non-partisan. That's a really important point to make, for the very simple reason that if Citizens UK, decided to get really close to one political party or support a political party, then the others would obviously just ignore them. And so it's an important principle. And Citizens UK has had a tremendous amount of success over the course of the years it's been operating. So, for example, the concept of the living wage in this country in its modern form owes a lot to the work of Citizens UK at running and setting up the Living Wage campaign and the Living Wage Foundation. Also been huge successes around the country on issues like housing, issues like mental health, which we'll talk about a bit more in a moment, and issues of rights at work and working conditions and so on. So their track record, I think, is impressive, and why I think it's really important in this conversation is if we want to have a new Sure Start around our schools, well, really, I think that needs to be based on the voices of the communities that schools serve, not on people rocking up and saying, well, look, you need this, you need that, here you go. So, what does this look like? I'll give a few case studies to illustrate the kind of thing that I'm talking about. I'll talk about Brighton, where the team there has had just great success. I'll talk about Bradford, and I'll talk about the Convention of the North, which was a joint action across all of the northern chapters of Citizens UK. This is from Brighton Citizens, and Brighton Citizens decided that a real focus would be mental health for young people, and in particular asking for counselling in schools. And this was based on having spoken to school leaders, spoken to school students, spoken to families around what is most important to you, what do we need to change in the city for young people. And the answer was, look, we need more mental health support in schools. There's a mental health emergency. We need that counselling provision in schools. And initially, the council weren't, too interested. But after some innovative and clever actions they took, after starting a petition, after getting on the media, as you can see there, eventually the petition had to be discussed by the council, and the students themselves got a meeting with the budget councillors, the councillors who set the budgets for Brighton and Hove City Council, and won a significant sum of money that is going to be spent on counselling in schools for young people. So a tremendous success there, really led by schools and led in particular by the students in those schools and their families. And that means that those schools now have that mental health support as part of that broader offer for young people and families. So I think it's a great example of how we can have this new Sure Start, but really based on the voices, the demands, and the abilities of people themselves to stand up and speak out and demand that change. So, going to move on now to talk about Bradford. This is Bradford Citizens Delegates Assembly last year, and you can see there we've got at that action we had over 200 young people from schools across the city, from about 30 schools across Bradford, coming together to decide what was most important to them. And the campaigns they've chosen are around mental health, similar to Brighton, anti-racism, and cost of living. And they've had considerable success with all of them. It's another picture from our Delegates Assembly. So on anti-racism, the students there, as you can see, have gone down to Parliament and have lobbied the all-party parliamentary group on Show Racism the Red Card around racism and racial justice in education. But they've also been speaking about mental health and campaigning around mental health. And that's led to NHS workers in Bradford being placed in schools and the further rollout of mental health support teams in the city to make sure that young people have got better access to mental health support in school. Again, very similar to Brighton, and again, that's building out those services in school, really following the needs and the voices of young. Finally, you can see that this is from the Convention of the North, where students, young people from across the North, from Tyne and Wear, from Leeds, from Bradford, from Manchester, from Liverpool, came together to, as part of the Convention of the North, to lobby northern decision makers, so the mayors, and they held meetings, for example, with Tracy Braben, with Andy Burnham, with Michael Gove, and Steve Rotherham there, and others, to bring their agenda as young citizens to key decision makers for the North. So we can see there that by working with Citizens UK and following that methodology, schools, it's not schools taking the lead. This isn't, the head teachers or the governors or whoever at the school, or the school trust, taking the lead. This is schools and trusts providing that opportunity, providing some space for young people and their families to stand up and say, well, actually, this is what I need in my life. And for that then to be incorporated in the wider offer around schools. And because of that, schools up and down the country have things like better mental health support. And that means those young people can be more successful with their education. So I think there's an incentive there for schools to think about, well, how can we allow these sort of structures to be built?
Good afternoon. My name is Matthew Mathia, and I'm a consultant general paediatrician working at the Bradford Teaching Hospitals. I have an interest in new models of delivering healthcare, and in the next few minutes I'll be talking about our hospital at home service and describing how this model is forging new relationships and collaborations and improving the quality of care we deliver. There is widespread acknowledgement from those working in frontline services in the National Health Service that it needs to transform to meet changing health demands, mitigate future risks, implement new evidence, and harness emerging opportunities and developments. Most agree that the focus needs to move from managing illness to promoting health, and the NHS needs to invest in illness prevention. This focus will inevitably mean that those in government and NHS leaders will need to work together to review NHS priorities and goals, change current targets, and move staff and resources away from hospitals and into the community. It will mean healthcare teams being supported to develop relationships and forge creative partnerships and alliances with parents and carers and those looking after our children. In effect, it will mean working upstream with citizens and the wider system. Like education, the NHS is an anchor institution and can be a significant force for good, improving and influencing social, economic, and environmental health in localities. This report showcases many examples of the significant benefits of bringing these anchor institutions together with local communities, social care, policing, voluntary sector, businesses, the local authority, and universities to develop more effective new models of health and care delivery. In West Yorkshire, Healthcare Partnerships and the Bradford Act as One collaboration has a shared vision for children and young people to be happy, healthy, and at home. This vision is providing a rallying call for all of us in our siloed organisations to jointly navigate a course to the devastating and persistent effects of inequities and the COVID pandemic. Setting unassailable goals that can only be achieved through these partnerships is going to be the key to success and sustainability. One such new model is the Ambulatory Care Experience, or ACE service. ACE Children's Nurses provide hospital-level care at home for sick children that is supported by paediatric doctors based in hospital. It was developed in Bradford through a partnership between primary and secondary care and with local communities and families. ACE aims to empower parents and carers to successfully manage common childhood illnesses at home and provides education to prevent future illness. The team also helps families to navigate the health system in the future and gives them advice on when and where to seek urgent help. The result has been to reduce hospital admissions. This intervention has been associated with a significantly lower readmission rate than those being managed in a traditional way. It has also reduced the costly burden of a hospital admission for families. Over 80% of children looked after by ACE are 5 years old or under, and as we know, these early years are crucial for establishing good foundations for future health and well-being. Home visits provide the team with a unique opportunity to discuss wider health issues and address more holistic challenges, including housing and financial problems and food insecurity. Safeguarding risks are more readily identified and managed in a timely way. ACE also signposts to local community support and interventions. All families are offered this holistic package. As ACE has developed, we are now looking at managing more medically complex children in the community. As these children are already known to the hospital, there is an opportunity to preempt clinical deterioration. These new pathways therefore include developing robust plans to manage illnesses earlier in the community. They also aim to reduce length of stay in hospital, should that become necessary. There is also hope that this service will close an important gap between home and hospice care for those at the end of life. This new model has involved working across traditional, professional, and organisational boundaries. Nurses have learned new clinical skills through university and RCN accredited focus training that is delivered by a multidisciplinary faculty. ACE has had several knock-on benefits, including developing relationships and trust between professional groups. It has built a collaborative team spirit that is marked by a willingness to experiment, an openness to fail, to learn, and to try again. There is a sense that the work is making a difference to the lives of children in Bradford and is developing the fertile soil needed for ongoing innovation in integrated practice. An example of this has been links with schools through promoting public health initiatives like asthma-friendly schools and the Healthy Together West Yorkshire website, which is a locally developed application that gives consistent, accurate, and trustworthy healthcare advice to families and professionals, including teachers. As a clinician, the pandemic shone a spotlight on the weaknesses of the NHS to keep the nation safe and well. For everyone, it was a clear reminder that our health and well-being is primarily a social, economic, environmental, and political matter, not a medical one. Our role as health professionals in the coming years will be to discover and harness what's already happening in our places and to become the supporting structure that allows transformation to happen in our streets, schools, and neighbourhoods. The 7 principles here, common to all of these reports, will be key to making our ambitions a reality. Thank you for listening.
Hello everyone, I'm Megan, a Research and Implementation Fellow within Born in Bradford's Centre for Applied Education Research, and today I have the pleasure of introducing you to the In-School project, which is one of the approaches to connecting health and education seen in the new Sure Start report. So just to add some statistics to those already in the report, it is estimated that there are 1.7 million young people in the UK currently living with a long-term health condition, which equates to around 11 to 17% of the pupil population. These are all young people who are likely to struggle in mainstream education due to unmet needs relating to their health in school, which in turn is likely to have detrimental impacts on their life prospects. So how is In-School trying to bridge the gap between health and education and better support these young people? The In-School project looks to investigate and understand the school experiences of secondary school pupils with long-term physical health conditions, with the aim of co-producing interventions to address unmet needs specific to young people's lived experience, with the longer-term aim of encouraging and developing joined-up policy and practices which are easy to implement across both health and education. So how are we going about this? The qualitative stage of the project, completed last year, so 2023, consisted of participant-driven interviews with close to 100 young people with various different health conditions, in which young people told us about their school experiences and any struggles they face when managing their health condition in school. Participatory analysis of the interviews then resulted in 6 key unmet needs identified by young people themselves, which you can see on screen here. We are now moving on to use these 6 key needs as well as the interview transcripts as a whole to develop a needs assessment questionnaire. This assessment consists of 6 sections, each relating to one of the key unmet needs. Each section has various statements which young people can either agree or disagree that the statement is true for them. For example, if I need to take medicines in school, I can do this comfortably and easily. The assessment is currently in the developmental stages, where we are attending outpatient clinics at the Children's Hospital here in Leeds to collect feedback from children and young people to ensure the assessment is understandable and covers each individual's experiences. Once the assessment is fully developed and rolled out across a larger population, the hope is for it to be used in schools as part of a new approach to developing individual healthcare plans, with more input from children and young people. This will help to bridge the gap between health and education and ensure these services are better set up for supporting our children and young people. Thank you.
Hi everyone, I'm Mallory Moorhead, Program Manager for the Born in Bradford Center for Applied Education Research. And we'll soon be reaching the end of today's webinar, but first I wanted to say thank you to today's speakers, to all the report contributors, and to those of you who are attending today's webinar and supporting the Child of the North and Center for Young Lives campaign. Our webinar started with a word from Anne Longfield on creating foundations for a new Sure Start in the UK based in education settings. Through today's presentations, we heard more about evidence. Hi everyone, I'm Mallory Moorhead, Program Manager for the Born in Bradford Center for Applied Education Research. And we'll soon be reaching the end of today's webinar, but first I wanted to say thank you to today's speakers, to all the report contributors, and to those of you who are attending today's webinar and supporting the Child of the North and Center for Young Lives campaign. Our webinar started with a word from Anne Longfield on creating foundations for a new Sure Start in the UK based in education settings. Through today's presentations, we heard more about evidence, policy recommendations, and about some innovative approaches to connecting services and stakeholders and building partnerships to improve outcomes for all children and young people. Now I'd like to share with you a little more on the report's end word, which was provided by Amelia and her mother Angela. Their contributions to the report are a reminder that behind every statistic, every policy recommendation, and every campaign, there are real lives, real struggles, but also real hopes for a better future. Amelia's testimony provides a look into the daily challenges faced by young people that are living with chronic health conditions and in educational settings. She shares her experiences of enduring chronic pain, which affects her school attendance, mental health, ability to maintain friendships, and academic performance, among other factors. Angela, Amelia's mother, shares her perspective, advocating for schools to be equipped and adequately supported and providing essential services for children that have chronic health conditions. She shares insights into the practical challenges that parents encounter in ensuring their child receives necessary support. In response to these challenges, Amelia and Angela issue a call to action. Schools must be invested in, and collaboration and connections must be made between services, schools, and stakeholders to ensure that young people have support. Schools play a central role in ensuring the academic and social well-being of all students, including those living with chronic and complex health conditions. And concerted efforts are needed to ensure that all students receive the support and resources necessary to thrive. We hope the next government will act on Amelia and Angela's call to action and commit resources to ensure education settings can be fully supportive of every child's needs. Their testimonies underscore the importance of this and the difference that change could make in the lives of those who need it most. In the words of Amelia, let us strive to create a future where all children have the chance to succeed. A future where schools receive the necessary investment, services are connected and collaborative, and every child's potential can be reached. As we draw the webinar to a close, let us carry forward the insights gained from today. We encourage everyone to join the 2024 Child of the North and Center for Young Lives campaign for a country that works for all children and young people. You can scan the QR code here, which will take you to the N8 Partnership site, and there you can read previous reports, sign up for future ones, and also sign our campaign petition. If you do have any questions about today's webinar or about the report, please reach out to carebradford@gmail.com. Thank you once again for attending, and we look forward to seeing you at future webinars. Thank you, everyone.